kind of attack.
Ventura Kwamboka, KTN.
Thank you, Kambuka, for that report. Now, to matters health, the United States government has expressed confidence that it will resolve concerns regarding the establishment of an Ebola center in Kenya that was dealt a blow Friday after the High Court temporarily halted its operationalization. In response to the court order, U.S. President Donald Trump's administration, through its Foreign Assistance Department, said that it was in touch with Kenyan authorities and optimistic that the teething problems can be resolved. This comes even as calls for transparency from the Kenyan government regarding the U.S.-Kenya deal intensifies and threats for mass demonstration against the deal gain momentum. Gloria Milimo reports.
Just a day after the High Court of Kenya temporarily halted the US-backed Ebola quarantine facility, dealing a blow to President Donald Trump's administration plans to set up the facility in Kenya. Saturday, the US responded to the court order, exuding confidence that the quagmire would be resolved. High Court Judge Patricia Nyaundi Friday issued conservatory orders temporarily barring the government from constructing Ebola facilities or allowing Americans infected by the disease to step in the country for treatment or quarantine. The orders followed a petition by Katiba Institute that sought to halt the establishment of the center, citing concerns about public safety. The proposed 50-bed capacity isolation unit at the Laikipia Air Base continues to elicit sharp reaction across the country. Despite a team of medics from the U.S. jetting into the country aboard 2 U.S. military aircrafts Friday to oversee the operationalization of the controversial facility, critics continue to question the rationale behind the decision to have the facility domiciled in Kenya and not the epicenter of the Ebola outbreak.
The disease has now been spreading on a very high rate in Congo, particularly because of the war that is ongoing in that particular country. And as such, we asked our government and also the regional governments that there should be more force, more resources and more experts that are sent to Congo.
The Kenya Medical Practitioners, Pharmacists and Dentists Union, through its Secretary General Dr. Davji Atela, also called for transparency from the Kenyan government over the deal, whose details still remain shrouded in secrecy.
It is only through transparency that we will know to what extent every Kenyan is protected.
A section of Doctors Friday had also raised concerns regarding the safety of frontline healthcare workers in the country in the event an outbreak was confirmed in Kenya.
We are acutely aware that what is incentivizing these irrational decisions by the ministry top brass is the allure of making Ebola billionaires.
This comes at the backdrop of the US government committing 1.7 billion shillings towards Ebola response in Kenya. While the Kenyan government has defended its decision to allow the United States to establish an Ebola quarantine and treatment facility in the country, the outbreak of the rare species of the Ebola virus Bundibujo continues to outpace response efforts in DRC. Confirmed cases in the neighboring Uganda have also risen to 9 after the landlocked nation confirmed 2 more cases. Uganda's health minister said the 2 new cases are both Congolese nationals. Meanwhile, the World Health Organization also confirmed the first recovery since the onset of the outbreak in DRC, after 1 patient was discharged from hospital after 2 negative test results. Gloria Milimu, KTN.
And 10 countries are now on Kenya's